Studying with the Open University is a unique opportunity, not just in this country, but I think in the world. And particularly for me, I'm a very mature student in my first year, and I've come from an established career where I wish to do, and I am undertaking a PhD on a subject matter that really needs to be done. And this faculty and the university recognised that.
The OU offered what I needed, especially the training that goes with the PhD. I've spoken to quite a number of PhD students from other universities. They don't have the framework of study that I have at the OU.
Studying at the OU is a great experience. I'm a new student, so I just started a few months ago. But so far I've had such a great time. It's a really supportive community to be in.
One of the advantages of studying at the Open University is, of course, the online facilities, which the OU is renowned for.
The Open University stands on its own in terms of it doesn't really have any comparison with other universities. Not just because the campus life is different, because obviously most of the students are distant learners, but I just think there's something about it that's much more open. There's not that kind of hierarchy that you find, unfortunately, sometimes in other kind of more traditional universities. I'm
at the right place. The OU is my spiritual home for my studies, for my PhD studies.
The faculty was really interested in the subject matter that I was proposing for my research, which I guess suggests that it's a faculty that is interested in new, fresh ideas.
I decided to come to Faculty of Health and Social Care because of the kind of outstanding academics that are in the department.
There are some of the world-leading scholars in my faculty area. So you've got access to all that sort of academic experience and academic knowledge, and you've also got access to a sort of a community that nurtures people new to research.
Studying at the OU has turned out to be very fruitful for me, what I expected, very enriching, offering me a lot of participation in what's going on within the faculty.
It provides a very flexible learning environment.
My substantive area is in social work, but actually I find that social work overlaps, for instance, with sociology, overlaps with psychology, and I've been able to work with other departments on my research area. When I've organized the conferences I've organized, for instance, I've been able to talk to other faculties about that, and they've been involved. Other faculties have invited me to their seminars, and I've also formed working relationship with people from other faculties, which will serve me well once I finish my PhD.
The supervision in my first year has been fantastic. I have two supervisors who complement each other enormously. They work collaboratively together, but particularly with me.
My first experience of supervision, the first session I was a bit nervous, not knowing what to expect, but I was put at ease by the experienced supervisors. Since then, I have enjoyed my supervision all the time. It's very frequent. Supervision team is always there in time, and I've been given a lot of support throughout. I'm so confident now to talk about my research.
The supervision meetings that I've had so far have been absolutely excellent. There's such a great opportunity to kind of discuss and interact with your supervisors about your ideas, and you really get that chance to develop your research, kind of the direction of your research. And so far I've been meeting my supervisors every fortnight, so it's been a really regular contact, which I think especially as a new student you need that kind of guidance as well. And they're also there not just for talking about the research ideas, but also to provide you support in offering you extra research training if you need it, and again just being there as well if you have the initial problems you have at the start of your studies.
One thing that really motivates me is the possibility of causing change in how we understand my research area. So before I started at the OU, I was a social worker. And one reason why I went into social work is because you want to change stuff, you want to make things better for people. And so from my practice, I learned that there were sort of gaps in the academic understanding of what I was doing as a social worker. So I thought if I then got into research, then through writing and researching, I could possibly contribute to the debates. In fact, I hoped I would contribute to the debates. So that's why I got involved in academia. And since I got involved in research, the more I have found out, the more I realize less is known about the area, which gets me even more motivated in the area, because I just realized the potential for me to contribute through my work.
And to have the unique opportunity to spend 3 years exploring a subject in the relationship of sexuality, disability and palliative care for young adults really drives me hard and enthusiastically to ensure that I will deliver something that not only has academic credibility, but will have a practical policy impact for young people who have life-limiting conditions, those parents and carers who support them day in, day out until the end of their lives, and also those professionals who also judiciously support them every day.
Completing a PhD at the Open University is absolutely going to be a valuable asset to you as an early career researcher if you wanted to go to academia. But also it can just open up many other avenues that you want to go down, if academic or otherwise.
My goal is to complete the PhD and have a career change. I've been a social worker for almost 25 years now, and I think I've done enough in the field. So I want to package my experience with the PhD and then either go into further academic work or do consultancy within child welfare and child protection.
I believe in lifelong learning, and what the Open University is enabling me to do is to feel actually my learning and my professional opportunities won't stop after these 3 years.
I'm hoping that my PhD will kind of contribute to the field in which I'm researching. Hopefully, perhaps cause me a little bit of stir, just kind of change the dynamics of the field a little bit. That would be great.
I can see myself going back into practice even as a social worker, but if I went into practice as a social worker, I was going to move up the career ladder, not necessarily into management, but actually into improving practice. I could also work for the Ministry of Health, for instance. I could work for other private organizations. I could work for charities in the area that I'm involved in. So a PhD opened even more doors for me than if I had remained as a social worker. So I think it's been rewarding doing a PhD.
I would recommend everyone to consider the OU for their PhD study. I would recommend that to my own daughter.